Okay, so I just want to check that we're viewing the right screen right now. It's not the presenter notes.
Yeah, looks good.
Okay, thank you. Hi, everybody. My name is Melissa. I'm a third-year PhD student in the Mental Health and Physical Activity Research Center, working with Dr. Catherine Sabiston. And as introduced, I'll be talking about student engagement in physical activity for mental health, the MoveU.HappyU initiative, which is a physical activity program that's specifically geared to supporting student mental health. And before I start, I'd like to thank you all for tuning into this presentation. So the purpose of today's presentation is to just understand the use of on-campus physical activity programming for student mental health, using the MoveU.HappyU initiative as an example. A secondary objective is to describe practical and evidence-informed considerations for engaging students in physical activity programs for supporting mental health and well-being. And lastly, we seek to understand the strengths and challenges of engaging in collaborative partnerships aimed at improving the implementation of physical activity programs for student mental health. So it is widely acknowledged that to better support student mental health, there is increasing emphasis on improving student access to traditional formalized treatment, in addition to broader and more comprehensive preventative efforts that are offered in the campus community. To highlight, research has demonstrated that students value a choice of treatment approaches and express interest in alternatives to psychotherapy or medication. In particular, there is growing interest in intervention approaches that promote engagement in lifestyle factors associated with enhanced coping and resilience, and intervention approaches that facilitate campus community involvement and a more inclusive and caring sense of community. These recommendations align with a growing use of systemic approaches for supporting student mental health on post-secondary campuses. So for example, an environmental scan of Canadian campus mental health strategies demonstrated that the majority of post-secondary institutions are adopting a systemic approach by developing broader, holistic, campus-wide well-being strategies. Systemic approaches for supporting student mental health align with socio-ecological models for public health and health promotion, and are based on the recognition that health is largely determined by people's environmental, economic, social, organizational, and cultural circumstances. From this perspective, student support services should be designed to meet students' mental health needs, ranging from preventative well-being initiatives offered in the campus community through to formalized treatment approaches for complex and enduring mental health problems. On-campus physical activity programming is one preventative mental health and well-being approach that is demonstrated to be effective and well-received by students. So for example, physical activity can promote mental health recovery and improve one's sense of community and social connection. Students have also identified physical activity and curricular activities as important experiences within the broader university setting to promote mental health and well-being. And lastly, engagement in physical activity has been associated with academic success, student retention, and a positive transition to post-secondary education. Informed by the promising evidence supporting physical activity for student mental health, we offer a physical activity program tailored towards supporting post-secondary student mental health. So this is the MoveU.HappyU program. The MoveU.HappyU program is offered at the University of Toronto and is implemented through the Mental Health and Physical Activity Research Center. The program is a 6-week one-on-one and individualized physical activity program tailored towards students seeking mental health support. Participants are primarily referred to the program by campus mental health care providers and through self-referrals. The program consists of weekly hour-long sessions, and each session consists of 30 minutes of engaging in physical activity behavior change strategies. So this is guided by a structured workbook. And then the second half of the session is engaging in 30 minutes of individualized and tailored physical activity training. So in terms of the behavior change strategies that we focus on, they are incorporated into each session where participants set weekly physical activity goals, assess goal progression, develop action plans, explore barriers and enablers to goals, and set cues or prompts for self-directed physical activity. For purposes of the current presentation, I'm going to present findings from our published mixed methods evaluation of the MoveU.HappyU program. This is based on the in-person delivery of the program. Of note, however, over the past few years, the program has been implemented online because of the pandemic. We have also been continually working with health and wellness services and sport and recreation services to implement the program to help enhance student uptake and engagement with the program. So following the presentation, I'm happy to answer any questions about the in-person versus online delivery of the program and the collaborative work with health and wellness and sport and recreation services. But as I mentioned, we use a mixed methods evaluation. So we used a quantitative approach to assess the effectiveness of the program in reducing symptoms of anxiety, depression, and psychological distress. And we used a qualitative approach to assess students' perceived acceptability of the program using semi-structured one-to-one interviews. So these numbers are based on student completion of the in-person program at the time of publication, and we've since enhanced our capacity to bring students through the program. But in total, there were 101 students referred to the program and 91 students were screened for eligibility. Of the 91 students screened for eligibility, 68 completed the program and 23 dropped out. Reasons for dropout included school-related stress, injury unrelated to the program, and reasons unknown due to unsuccessful follow-up. Importantly, however, there were no significant differences between those who completed the program and those who dropped out in baseline characteristics, including age, anxiety symptoms, depression symptoms, or psychological distress. In terms of the quantitative results, the results demonstrated that the program was effective in reducing symptoms of anxiety, psychological distress, and depression symptoms. And for the one-on-one semi-structured interviews, students discussed the acceptability of the program from the perspective of program design and the perceived mental health benefits associated with participating in the program. In relation to the acceptability of the program design, participants discussed the benefits of a program that is one-on-one and individually tailored and structured with an emphasis on behavior change. Students also discussed the value of physical activity as a holistic approach to supporting student mental health and viewed the program to be an acceptable and effective intervention approach. As Sophia mentioned, I just think it's a different way to think about mental health and approach it. I think it makes it a little less scary to reach out for some help. I think it would surprise people how much it does. Your mood changes when you exercise. It's something that is hard to realize until you get into it and start working out. And this is a good way to bridge that gap. So taking the findings together, the acceptability and effectiveness of the program in improving symptoms of anxiety, depression, and psychological distress was demonstrated. In terms of student engagement strategies and as supported by previous literature, physical activity interventions that are supervised and individually tailored to students' needs and goals may be particularly important for achieving mental health benefits and for overcoming student barriers to engaging in physical activity, including a lack of motivation or a lack of perceived time. Additionally, previous research supports the benefits of moderate intensity physical activity to achieve mental health benefits. However, it is becoming increasingly recognized that physical activity at low doses and that is enjoyable may be particularly important for enhancing motivation for regular engagement and for obtaining mental health benefits. And lastly, the incorporation of behavior change strategies, including self-monitoring, goal setting, and overcoming barriers was discussed as important for promoting PA behavior and for students connecting and experiencing the benefits of physical activity for mental health. So despite the growing evidence supporting physical activity for student mental health, there remains significant barriers to implementation and student engagement. In particular, the delivery of physical activity programs for supporting student mental health in real-world context is underused. This is often attributed to a knowledge to action gap, where research findings and knowledge are not being translated into practice in a time and resource efficient manner. To optimize the mental health benefits of on-campus physical activity programs, there's a need for researchers and practitioners to consider factors that may influence the translation of research into real-world contexts. Specifically, research that we conduct in our lab supports a need for collaborative practice and co-produced research with students as strategies to facilitate knowledge translation. Collaborative practice in this context is defined to occur when multiple health-related professionals from different backgrounds work together with patients, or in this context, students, families, and/or communities to deliver health-related services. Within a post-secondary context, strengthening collaborative practice between counseling centers and various departments on campus, including residential life, athletics, and student communities, is suggested to be important for increasing participation from students in programming opportunities and to the development of more tailored and relevant physical activity programs. Challenges in regards to collaborative practice, however, include a lack of knowledge and awareness of physical activity for mental health among campus collaborators, and uncertainty in regards to roles and institutional support. Future work is needed to further explore strategies to guide collaborative practice and facilitate institutional support. So, for example, the development of structured protocols for collaboratively implementing physical activity programs for student mental health. And lastly, there is a need for co-produced research with students. Co-produced research prioritizes the lived experience and involvement of students throughout the research process. It is important for producing experiential knowledge and for positioning students as experts in their own lives and mental health care. In turn, this is suggested to have benefits for increasing the relevance, utilization, and impact of research findings in real-world contexts. Co-producing research is also important for providing student-centered mental health care and for understanding the mental health needs of a collectively more diverse student population, so across students' gender identities, ethnocultural backgrounds, and socioeconomic status. Despite a shift to student-centered mental health care, there remains a lack of voices from those with lived experiences in the design and development of mental health and well-being interventions, including with physical activity interventions. Future work is needed to enhance student engagement in the design and delivery of physical activity programs for student mental health. So to conclude, physical activity is increasingly demonstrated to be effective and an acceptable preventative intervention, and may be important for expanding the range of mental health services offered to students. To enhance student uptake to programming opportunities and the relevance of physical activity programs, future work should consider advancing our understanding of collaborative efforts between physical activity professionals, mental health professionals, and students to develop tailored and scalable physical activity programs for student mental health and well-being, and to develop training and education opportunities to enhance awareness of evidence-based practice for implementing physical activity programs. So that concludes my talk for today. If you'd like to reach out with any direct questions, please feel free to email me at this email here. And I'm looking forward to the Q&A period after this. Thank you.